Hello. So I'm here with Miss Allerhead, AP psychology teacher and educational psychologist at the Roland Park Country School in Baltimore, Maryland. And we're here to talk a little bit about the mental disorder of schizophrenia. And my hope is to sort of get your take on what it is to interact with these people who, though conflicted by their illness, are still humans just like us. And so perhaps you could introduce yourself a little bit and speak briefly about the situations in which you were confronted with people suffering from this disorder. And then I'll give some follow-up questions following that.
Certainly. My name is Peggy Allerhead. I have a master's degree in school psychology and a certificate of advanced study, an additional graduate degree in school psychology, and I'm a certified school psychologist in the state of Maryland. Um, my experience is largely in the school setting and in some public nonprofit institutions at Kennedy Krieger. My background is largely as an educational diagnostician, and I don't have a lot of extensive experience with schizophrenic patients. Some of my experience is really from a personal level as an community outreach worker in Head Start programs and in earlier anti-poverty programs. So I understand schizophrenic patients from sort of a systems approach and working with their families and working with them in community settings. And then I have experience with family members who are schizophrenic and past students who have come to develop schizophrenia, you know, after they've left our institution and are out in the world.
Great, thank you so much. And so maybe could you tell me a little bit about sort of that experience with, interacting with these patients, sort of what is it like to speak with a schizophrenic? Are you able to connect with them? Do you find them sort of functional in society? So just sort of,
Well, that's a very difficult question because one of the issues of mental health in general, but even schizophrenia in particular, schizophrenia is an illness that we know a little bit more about. It's approximately 1 in every 100 individuals all across the world seems to be um, genetically predisposed or to be likely to develop schizophrenia. That incidence rate is really constant and leads us to understand that there's probably a biological or genetic component to schizophrenia. That being said, each individual is so very different in terms of how they present, but and it's a disorder that seems to have an ebb and flow and peaks and valleys. It seems to be a lifelong disorder once somebody's been diagnosed with it, but there are flare-ups where people's symptoms can be more severe than other times, so it makes it really challenging. But one thing I would say is that it is a severe mental health disorder. It does seem to have a lifelong course, and it's something that's best understood, I think, in thinking of the individual, their family, and society. These are people that we know are part of our community. They're people that we love, that we care for. They could be in my family or yours. And I think it's a challenge for us as a society to really look at these people and think, you know, they're a person who has schizophrenia. They're not just a schizophrenic.
schizophrenic, exactly. And that distinction is very, I think, important in all mental health. There's all the stigma behind mental disorders, and sort of being able to sort of understand that they are people. That's what they are first. They're people that have this disorder, and it's something that it's not necessarily what's wrong with them. There's nothing wrong. It's just something that they have, and it's one of those things that can sort of inhibit some sort of their functionality of certain things, but they're still people.
And one of the things I found really is that a lot of people's views of schizophrenia are flavored by what they've seen in the media. And some of the most vivid examples that people have seen are individuals with schizophrenia whose symptoms aren't controlled, who may have be paranoid, who may have committed some act of violence, and that's what stands out in people's minds because it's very vivid, but it's such a small percentage of individuals with schizophrenia. Most of the people I knew with schizophrenia were people of promise, people who, growing up, may have had a few bumps in the road, but they expected to live a life just like anyone else. And it was in their late adolescence or early adulthood that it seems like their life was derailed by this illness. And, um, and even after they were in treatment, if not the illness itself, by the complications of the medication and their treatment, and by the stigma that our society holds for people with mental illness. So I guess that's primarily my experience. Some of the most positive things I've seen for individuals with schizophrenia is where they were in a supportive community, where sometimes formally, like when in the San Francisco Bay Area, there was a supportive community mental health outreach where they had living situations and social skills training and job skills training. There was they had a food co-op and a small vegetarian restaurant that was run by the clients in their program, and they were able to contribute and be contributing members to their social setting. And it was such a positive experience for those individuals to be able to live and contribute. I mean, they have the same goals as most of us, they just have more challenges. And in a very unstructured way, some of the areas I lived and worked in were close to First Nation or tribal areas in the western United States. And in some of those areas, individuals were just accepted and supported in their communities and families as people that, sometimes had their, they heard voices or they did things that weren't as expected, but people were just sort of unforgiving and accepting, and those individuals seem to have found a place and a way to function in a environment that was supportive, and it wasn't any formal structured program.
Interesting, and that's interesting that you sort of mentioned this sort of the support system and sort of this necessarily getting help. And I think that there's a striking statistic that by a study by the NIH, National Institute of Health, recorded that 64.3% of patients with schizophrenia seek help, according to the study by NIH. So there is a good amount of patients that and people that are afflicted with this disease who are not getting help, and perhaps we want to get that number up, and maybe you have an idea of what can be done to sort of get that number maybe closer to 100%, where everybody who's struggling with this disease is really getting their help that's needed. I mean, of course, there's the stigma behind mental health, but
I also think it's not just a stigma. I also think that there is not accessibility to affordable mental health care treatment and quality mental health care treatment across the United States. There's large numbers of underserved areas, and it's hard to imagine if you live and grow up in an area like Baltimore, Maryland, but there are many areas where mental health services are just, and practitioners are just very difficult. It's just very difficult to access services. A lot of people who are suffering from a mental health issue, whether it's schizophrenia or other issues that are at times debilitating, they may not be in a situation where they're working and have access to health insurance, and there isn't parity for mental health and physical health in many insurance policies. So there are many people that may be motivated to get help and are unable to get it, and people who with schizophrenia who may have not be as in touch with reality when their family members try and get them help. There are roadblocks in getting help for a family member that doesn't have insurance or that doesn't recognize their own illness at a time. It can be very challenging to get help for individuals. It's not like if you knew today that your best friend had schizophrenia and wanted to get help, that you could get them help.
Yeah, of course. There's a lot of sort of
lot
loopholes
of
and roadblocks, obstacles that are along the way to sort of
Yes.
making that accessible. So the one thing that we think of this debilitating disease, and we can't help but sort of ask ourselves, what can we do individually to sort of better help these patients live with schizophrenia, and also help sort of support research and an understanding to to sort of help fight and cure this sort of disease, this illness that we don't know much about. What do you think we can do as sort of individuals within a larger community to sort of, um,
Well, I think one thing is to advocate for parity for mental health services. I think to be supportive of some of the organizations that are out there and working really hard, like the National Association of the Mentally Ill, um, and actually that are really on the front lines working with families and clients, patients who are suffering from mental health issues and who are looking for help. Um, I think research into the um, biological underpinnings and finding treatment. One of the issues about treatment for schizophrenics is some of the treatments that are in use have side effects that are unpleasant, and so individuals who seek and use medication sometimes, when they're feeling better, they have a tendency to want to go off their medication because some of the side effects are unpleasant, to say the least.
And that's interesting that you sort of mentioned that, because it's one of those things where somebody who suffers from schizophrenia takes their medication, they feel like they're no longer their real self, their true self. There's a part of them that's kind of taken away by that, by the medication, which is sort of one of those reasons that we do have a large number of sort of patients who go off their medications in schizophrenia.
There's also some research that's being done just helping people with reminding about medication. I know there are people that have developed, watches that buzz and remind people to take their medication. So there are things like that. I think you may have heard me say before, I think as individuals, just a matter of being kind and understanding, and if there's something like a supported workshop or a restaurant that hires and employs individuals with schizophrenia, utilizing their services, supporting them. And someday, when you're an employer, think about hiring someone for a job, knowing that you may have to provide extra job support or extra job coaching in the beginning, but that it's a valuable contribution. These people have a lot to offer to society, even if it takes a little bit more work and effort.
Interesting. And sort of leading to my final question, of sort of a future of sort of understanding this illness and how we can kind of, largely combat this illness is sort of established in research. A lot of this is lying in research, and there's research ongoing about biological underpinnings and psychosocial sort of treatments to sort of help fight schizophrenia. Where do you think that sort of the future lies to understand this disease? I think that we often hear the sort of the discrepancy, the dichotomy between sort of medicine versus counseling, and one maybe being better than the other. I mean, do you think there's a specific sort of area where research should focus?
Actually, I think it's a dichotomy that shouldn't exist. I think that you really need to look at the whole person, and so I think looking at a pharmacological approach to treatment of a disruption in neurotransmitters, that's helpful, a nice way of looking at things, and that would be wonderful if we could find a pharmacological treatment that could manage or control symptoms and also not have side effects that are debilitating to the individual. So I think that's one important avenue that has to continue to be addressed and researched. But you can't separate that from the needs of the individual and the needs of the community and the needs of the families when individuals, they're supporting someone they love who is struggling with this disease, and the toll it takes on the whole family system. I don't think you can separate them. I don't think it's one or the other. I think that they're complementary.
And I totally agree with that sort of that statement. I think that there's a lot of as Americans we tend to in science we tend to sort of create that separation. Though at the end of the day, there's research that shows that the two in conjunction are most effective. And I think that it's something that's important to realize is that they're not separate. They're together, and they're intertwined, and that they sort of combine together to help combat and